what we went from there was trying to figure out what is the cause of this high intracranial pressure and what else is continuing to make us sick, because this is not the only cause for our POTS symptoms. We started to look at the vagus nerve, and I think you have to look at the vagus nerve anytime the heart and the gut are affected simultaneously, because they're both under the control of the vagus nerve. And we've been studying that for quite a while. I released at the International Society of Neurovascular Disease what I presume to be one of the links between some of our vascular problems and the vagus nerve. It's a great review for what does the vagus nerve control and how it may mirror what is wrong with a lot of POTS patients. So I wanted to show you this 4-minute video and see what your thoughts are.
Because this is where it starts to get interesting. So heads up. What do all of these have in common? All the following: gastroparesis and IBS, dysphagia, difficulty with speech, sleep disorders, GERD, low gallbladder ejection fractions, liver enzymes are off, bradycardia, tachycardia, palpitations, insulin resistance, a decrease in immune system, as we talked about, an increase in inflammation, drastic increase, and the HPA axis going wild. One thing can control all of those. Any ideas? Okay, I have to keep hands here. So vagus nerve compression. Whoa! Here's a beautiful sonogram showing the common carotid artery in the IJV. The white arrow points to the vagus nerve. That really got me thinking. The vagus nerve, as you know, is the parasympathetic nervous system pathway, basically. It's the cholinergic anti-inflammatory pathway. So when that is not functioning well, we get more inflammation. We get more inflammatory cytokines. It's mainly afferent fibers. So it communicates with the organs to the brain both ways, but definitely from the organs to the brain, it tells the brain the state of the organs, and that can communicate back. If that communication is lost, we can lose quite a bit of proper organ function. Now, it's also considered to be the interface between the brain and the immune system. Now, this I found amazing, because the macrophages, which come in, for example, in MS and help clean up, or what we believe to clean up the mess of broken myelin, etc. Well, when they are not under control of the vagus nerve, if that vagus nerve is compressed, all the rules change. The macrophages actually release tumor necrosis factor, the big daddy inflammatory cytokine. And there is one spot on the macrophages that the vagus nerve controls. It's called the peripheral alpha-7 subunit containing nicotinic acetylcholine receptor. Okay, and that prevents that release of TNF in a normal, healthy patient, but not if the vagus nerve is involved. So this, of course, since the parasympathetic nervous system now is not working as well, the sympathetic nervous system is overriding everything. And what that does is dumps into our bodies all these catecholamines, norepinephrine especially for us, epinephrine. And what do those do? They drastically increase inflammation and the output of inflammatory cytokines. Here we go again.
So ironically, during that talk, my ileocecal valve, that's the valve between your small and your large intestine that allows the stool to pass on, was slammed shut. I was suffering with gastroparesis during the talk and went home fairly miserable, actually spoke against my doctor's wishes. I was left at home. It had been, 11 days since I'd been able to have a bowel movement. I went to the emergency room. I was desperate. We had tried everything that I knew of to try for gastroparesis. Nothing was working. Went to the ER and they prescribed prokinetic agents like Reglan. Those were ineffective also. My urologist was able to confirm that indeed my ileocecal valve was slammed shut. And he sent me to a surgeon. We consulted with the surgeon. He said it's really not a good surgical procedure to have done. If there's any way we could control this non-invasively, that would be preferred. So again, I went home, had no help, and laying there in bed, absolutely miserable. But what do you do then? You know, what are we supposed to do when we're left without our experts knowing what to do? I did the only thing I could do, and that was presume I was correct. Let's just say I am right, and the vagus nerve is affected, and let's just say it was compressed, the side of the carotid sheath in my neck. I didn't know if that was the case, but let's just say it was. That is there a way that I could help myself knowing this? And indeed, I have got to give a big shout out to the University of Houston College of Optometry for their excellent education, because I was able to remember back 30 some odd years before our autonomic nervous system lecture and thought about some of the special characteristics of the vagus nerve and how I could perhaps use those to help my own condition. So a quick review here. This is a picture of a nerve on the left. The yellow represents a neurotransmitter. The other blue part is the organ. So a nerve fires, it releases a neurotransmitter or a chemical that jumps across the gap, the synapse, and lands on receptors of the organ, and that makes the organ work. And the organ would be, for example, the ileocecal valve would open, or the GI tract would respond with movement of the stool throughout, that sort of thing. And that's how the vagus nerve works. Am I right? Almost, but not quite. We have another opportunity to help ourselves. The vagus nerve is special, and this is what I remembered from my notes. It's a parasympathetic nerve. There's a long preganglionic portion. That's the part of the nerve that goes from the brain down the neck to the side of the organ, right? There's a little synapse or gap, and then there's a tiny, tiny little postganglionic nerve that's at the side of the organ. It is almost just part of the organ. It's so, so small. And I had thought, I've never had abdominal surgery. I don't see any reason why that postganglionic portion of the nerve wouldn't still be functioning. Unless I had some autoimmune problem affecting the receptors, I should be able to help that postganglionic nerve respond somehow and perhaps have a normal bowel movement. So what I did was I called my husband and asked him to bring home an agonist for that postganglionic nerve. See, we can't use acetylcholine as a neurotransmitter. We can't use that as a drug because the body breaks it down immediately. As soon as it enters the body, it's broken down. We have to use a mimicker or agonist of the neurotransmitter to respond. And the vagus nerve, of course, is a nicotinic acetylcholinergic nerve. A good agonist would be nicotine. So he brought home a nicotine patch, and I put it over the site of the ileocecal valve, just hoping to get in that area of the GI tract. And what happened? About an hour and a half later, things started moving. The ileocecal valve opened. I had a normal bowel movement. Woohoo! So I continued to use that patch for 3 or 4 days at nighttime, and my gastroparesis was basically gone. So, holy cow. All we have to do is use a nicotine patch, right? Right? Not quite, because by the 3rd and 4th day, remember we talked about the activation of those histamine-producing cells? Oh my. Mast cells or whatever cells were all releasing it. It felt like I was being eaten alive by fire ants, and my abdominal area was purple, and it was just horrible. So the histamine had gone out of control. Could not rely on nicotine, certainly. But what it did was it switched the research we were doing to looking for these rare or unknown autonomic conditions that would affect the receptor, to instead looking at things that would affect the neurotransmitter or the preganglionic vagus nerve. I did not have a receptor problem. My receptors were working great. Autoimmunity was then off the table. This was a neurotransmitter problem. So we could switch our research then to focus on acetylcholine. We looked at every genetic condition we could think of that involved the production of acetylcholine. We looked at other reasons that it could go down. We also studied everything we could find on the preganglionic portion of the vagus nerve. Now this is where it got really interesting, because for those of us with EDS POTS, but also chronic fatigue syndrome and many, many cases of chronic Lyme disease, something became apparent. And I wanted to thank everybody here who filled in their symptom checklists and sent them in to prettyill.com. How many of you guys did that? Thank you. Because those were hugely helpful. We had hundreds of those, and something jumped out at me. Now, mind you, it jumped out at me after 4 years of studying them, but we did collect them over about 4 or 5 years. And I wanted to show this to you to make the point. I'm going to show you a list of symptoms. Please take a look and you tell me what you think these are symptoms of. Initially, it's going to look like these are symptoms of POTS, or autonomic dysfunction. Try to get that out of your mind and think, what else? What syndrome is this? And see if you recognize it. If you do, just call it out, okay, like bingo or something. Let me know what you see. But these could all be receptor problems. Let's take a look. I think all of us with POTS understand these symptoms, but let's look further. These are more central nervous system symptoms. Let's take a look at these. These also are looking familiar, right? I know I experienced the majority of these. Now, the ones that jumped out at me were the visual symptoms. Some of these visual symptoms are a little odd, and when patients would first explain them to me, I had no idea what they were talking about, honestly, until they started to happen to me, and then I kind of got it. So let me know if you recognize this syndrome. But these are the visual symptoms that jumped out at me. Interesting, right? Any ideas? These are all signs and symptoms of acute anticholinergic poisoning. It is as if we have ingested something, a poison, if you will, that has broken down our acetylcholine. We are so deficient in acetylcholine that it's as if we've been poisoned, which is very freeing for me because I had said for many years when I developed POTS, it felt like I had been poisoned and electrocuted, but I'd never been poisoned before. But that's what we were exhibiting. So could we be suffering from a problem with our acetylcholine? And that's where our research turned. So how is it that I recognize this and not everybody else recognizes this? I'd love to think that it was because I was so brilliant, but not so much. I don't think that was the cause. Yes. You see, eye doctors are very familiar with acute anticholinergic poisoning because we prescribe anticholinergics every day. We use them in the office constantly because those drops that you've had before to dilate your eyes, for example, those are anticholinergics, and we learn what the symptoms of poisoning are in case, say, little sister Susie or something grabs one of those bottles and sucks on it. We need to know that presentation. ER doctors are also good at recognizing anticholinergic poisoning because people who have been poisoned usually show up at the ER and they can recognize it based on presentation. It's not something you can diagnose with blood work. This is truly one of those invisible illnesses, if you will, because acetylcholine is immediately broken down by the body, right? You have to diagnose it based on presentation, signs and symptoms. So why were we not judged to have low acetylcholine? Again, we have so many symptoms. We have a basically chronic disorder. We don't usually show up at the ER with those isolated groups of symptoms. We're just sick all over, and it's not really something that's acute or something we would take to the ER. So it had gotten missed all that time. Interesting about anticholinergic poisoning, the first two things that they do for you in the ER, the doctor will do when you're diagnosed, is they give you Mestinon and Xanax. And those are two things a lot of us with POTS lean on. I mean, I was popping Xanax like they were Pez candies for years. I was so hyperadrenergic. But indeed, that's one of the treatments and could be one reason why we respond to those medications. So my thinking was, okay, if we have a neurotransmitter problem, this nicotine patch thing wasn't going to work. Wouldn't it be awesome if we could come up with some sort of oral medication or mix of supplements that would replace the acetylcholine in our bodies? And could that do okay for us while we're scrambling to figure out why it's not there? But what we were looking for, and we had a small team of genetic disease investigators working on this for a few years, we wanted to be able to stimulate that vagus nerve. We wanted to have everything come together so quickly that it could stimulate a bowel movement, much like the nicotine did, but it could not activate any of the histamine-producing cells. Very important for us. Also, we use acetylcholine in our brains, not just for gut and heart function, right? The central nervous system disorders or the symptoms you saw, we need that to think and to create new memories. And I don't know about you, but when I was at my worst, I couldn't think or create new memories. That was just off the table. We wanted to replace it in the brain, so it needed to cross the blood-brain barrier. That was important. It also needed to be, at least we preferred it to be, all the ingredients had to be below what the FDA had already found to be safe for us. Very important. And then finally, although we were looking at all the genetic defects we could find, I didn't want the patients to have to figure out where their genetic defects or attributes lied before they could figure out if this would work for them. I needed it to work no matter what. And those were our goals, and we spent about 3 years working on this. It was interesting because the other thing that came into play was organic chemistry. And I got to thank the University of Texas at Austin, hook 'em horns, because my undergraduate school, I did take organic chemistry a gazillion years ago and had to pull up that knowledge to help pull some of this together while we were working on this. So for those of you who are in school, students, and you're sitting in a class and thinking, I am never going to use this information, you might be surprised. Just stay in school. So what we did, we were trying to work on this vagus nerve, so we watched for what the vagus nerve would help us do. And as just a very brief review, this is all on vagusnervesupport.com, by the way. You can find this there. But the vagus nerve supports peristalsis, where it pushes the food down into the stomach and then through your GI tract. It also controls the release of stomach acid when you eat, and opens the pyloric valve, the valve at the base of the stomach, to then let the stomach contents go into the intestines. It allows the pancreas to release pancreatic enzymes to help digest. It tells the gallbladder when to release bile, and it opens up the tiny sphincter of Oddi, which is a small sphincter where these digestive juices and bile are released into the intestines. And I noticed that a lot of patients with POTS were suffering from breakdowns in almost all of those areas. It also, the movement of the stool in the GI tract triggers the opening of the ileocecal valve through the gastroileal reflex. Very important. Now, we also wanted to help the brain, right? The neurotransmitter there. So what else it can do is help with brain function. Hugely important and necessary. It can also help with immunity and anti-inflammation. A lot of us have abnormal immune systems and we're horribly inflamed, but the vagus nerve serves the spleen, which helps us fight inflammation and fight disease. And it goes to, the acetylcholine works on a lot of the inflammatory cells to control them, to keep from re-releasing inflammatory cytokines that you saw in that video. We could use that. It also helps slow the heart through its connection with the sinoatrial node. We certainly need that. And the parasympathetic nervous system, controlled by the vagus nerve, is the rest and digest system of the body. A lot of us with POTS end up in what appears to be an abnormally high sympathetic nervous system output. We're just buzzing. We can't sleep. We're nervous. We're the whole bit. And we can't digest either. What it looks like to me is more that the parasympathetic nerve is underperforming, which is awesome because that is treatable. It's much harder to calm down the sympathetic nervous system. So I wanted to tell you just a little bit about what this did for me when we were testing it. I was a very severe case. I was so sick. In fact, at my worst, I could only stay awake at the most 3 hours a day. And during those 3 hours, I did not want to be awake. I wanted to be asleep. I was totally exhausted. I told my neurologist that it felt like I had run out of something, right? I could maybe make a to-do list of 1 or 2 things, and I was so exhausted at the end, I couldn't do either one of those. I really felt like I was running out of something, and he just didn't know what it was. Replacing my extremely low levels of acetylcholine was pretty much immediate. Within about an hour, you can feel things coming back. And initially, I was so depleted, I could also then feel it wear off. I would take some more, and I could feel it come back. It was almost like I was being sucked back to life after having Alzheimer's or something. It was that severe. So it was absolutely life-changing to have that put back into place. The other thing that was so incredible is the gastroparesis. For those of you who have suffered with that, especially for years, we get very used to surrounding our day toward looking at trying to have a bowel movement. I had 4 large Tupperware containers of every GI medication known to man to try to help myself have bowel movements, and every once in a while I would have severe diarrhea, which was awesome because it was the only thing that would help relieve the constipation. What a horrible way to live. But it was so tremendous to have that function return and have it return so easily that to get up in the morning and take my Parasym Plus, oh, that's what we're calling it, by the way, Parasym Plus, take that, have a little cup of coffee, and within 30 minutes or so, I have success in the bathroom. So it was so tremendous. It really does change your outlook entirely. And to not have to think about it anymore is tremendous. I love that. The other thing that it was very helpful for was I was told twice to have my gallbladder removed, and it wasn't functioning. The gallbladder ejection fraction was very low. This was one of those tough decisions. I was having pain at the time. We didn't know the source of it. Turns out it was the ileocecal valve. We didn't know at that time. But the doctor explained to me I needed to have it removed. So my questions were, is it filled with stones? That would be a reason to have it removed. I said, no, it's not filled with stones. Okay. Is the opening from the gallbladder where the bile comes out, is that okay? Does it look like it's opening okay? Her answer was yes, that looks normal. Then it sounded like the organ was basically okay. And my thought was, perhaps this is neurological. I think I just need to think about this. Let's wait on it. It doesn't appear that I'm in any danger by leaving this organ. And I didn't want to remove a healthy organ if we could maybe figure this out. So indeed, immediately, my gallbladder started to respond again, which was tremendous. So last year, many of you know I was in the hospital. I was so severely ill. I had some infections and developed hemolysis, where your red blood cells are destroyed, and we kept having transfusions. Then I got a hospital-induced infection. Everything just went horrible. When I got home, I got worse, and my inflammation went crazy. I developed steatorrhea. Steatorrhea is where your stool looks basically whitish clay colored, if you will. And there's oil on the top of the water in the bowl. I mean, you can't miss when you have steatorrhea. Instantly recognizable. I was way too sick to go to a doctor at that point. And nobody would touch me, nor should they have. I was so incredibly ill. But I thought, is there a way I can help myself? Can't get anywhere. This is serious. It could be pancreatitis, sphincter of Oddi dysfunction. My gallbladder may have shut down again, or any of the above, right? I had gone off of Parasym Plus because I didn't really feel like I needed it anymore. I wasn't fatigued, and I thought my bowel function was adequate. decided, let's go back on it. If it helps with inflammation, perhaps it would help with the inflammatory part of pancreatitis, if I was dealing with that. It helps with inflammation and with the gut function. CT in the hospital indicated I wasn't having normal bowel movements like I thought I was, so perhaps it would help that too. Got on it, and 2 days later, the steatorrhea was gone. Things were starting to turn brown again the way they're supposed to. So I knew at that time we really needed to work hard to get this out to you guys, that it's very powerful. It was something I decided then I would just never go off of it. Even when I couldn't tell the difference, it was doing something for inflammation that I wasn't even aware of. So